Hello. You must have had so much of hassle going through the first part of your treatment, that is either surgery or chemotherapy, and or your doctor must have told you now that you need to see a radiation oncologist to get some radiotherapy for your breast cancer. Well, let me first reassure you, radiotherapy for breast cancer is likely to be the easiest bit of your treatments among chemotherapy, surgery, and radiotherapy. Radiotherapy is treatment with high energy X-rays, so you don't see it, neither can you feel it being delivered. However, there are certain common side effects that we're going to discuss now. Well, look, coming and going for radiotherapy is not over just one day. You will need a period of usually 3 weeks or sometimes 1 week to complete the course of your radiotherapy. Now, this radiotherapy is given every day of the week, Monday to Friday usually, and then if it's 3 weeks, 5 times 3 is 15, so you'll need 15 treatments, or if it's 1 week, it's a 1 week, 5-day course of treatment. Now, during treatment, as I said, you don't see anything happening in the initial phases of the treatment. However, whilst you're going ahead with the treatment, you do get to see some of the early side effects of radiotherapy. Whilst coming and going, you might feel a bit tired. I suggest you keep yourself well hydrated, and that is going to help with your tiredness. Simple exercises, simple stretching, or sort of getting into some yoga regime is going to help you with the tiredness of radiotherapy. The skin of your breast from the second week onwards might feel a bit red. The breast might also feel a bit swollen. Now, this is again a very early side effect of radiotherapy. Slightly reddish skin or slightly darkish skin in a dark complexion woman is pretty common. Now, whilst you're having these side effects, you will almost certainly be reviewed by your doctor or a specialist nurse once in a week. Whilst you have these side effects, do let them know there are certain creams that can be applied if the redness is getting worse or if the blackish part is getting worse. The skin swelling of the post-radiotherapy or the swelling of the breast feeling heavier during radiotherapy is something that will over time settle down, so don't you worry about it. If you have pain or if the swelling is getting too bad, do let your doctor or your nurses know. There might be some underlying problems that then needs to get treated, because radiotherapy per se would not cause any pain during the treatment. Radiotherapy in the modern era is delivered in a much more focused way. So we target the radiation to the breast and also target a higher dose of radiation around the area where your tumor was. This treatment, as I said, is usually delivered over a period of time. Sometimes, if women have cancers of the left side, doctors may often like to reduce the dose to the heart. And in trying to do so, they might give you some exercise regime for breathing. And these breathing exercises can actually help you to push the heart back such that there is less radiation that is affecting the heart. I would not actually get too stressed about the amount of breath that you can hold or the duration that you need to hold it for. The modern machines are very well programmed to try and synchronize the radiation with your breathing. So try as much as you can to get acquainted to those exercises and then leave it to the specialists, the radiographers, the doctors and the nurses to try and give you the best treatment available. A few other early side effects of radiotherapy include loss of hair in the area of treatment. If you need treatment to what is called axillary lymph nodes with radiotherapy, you may actually result in loss of axillary hair. The other side effect does include feeling a bit nauseated. Now, nausea is not usually a known side effect of radiotherapy, which is very common. However, some people do complain of nausea. Now, if you do have it, do let your doctor know and they will give you some medicines for it. And finally, radiotherapy in the early phases may also result in stiffness of your shoulder. Now, if this happens, do again let your doctors know. You should have been given a regime for exercising. Now, whilst you're having the radiation, These exercise regimes need to be repeated every day, and this will reduce the chances of having a shoulder restriction. In the longer term, radiotherapy can result in slight darkening of your skin, that is the skin of the area that has been treated. The skin may be slightly rough. There might be slight changes in the texture of the skin. And also remember, the breast might feel a bit different post-radiotherapy, which over time should get a bit better. Radiotherapy long-term side effects do also rarely include something called lung injury or pneumonitis. This is a very rare side effect, and modern radiotherapy, especially under a quality doctor, would possibly reduce the chances of you having these side effects at all. For left-sided cancers, in spite of the modern regime, there is still some leakage of radiation to the heart. And when you have even a minimal leakage of radiation to the heart, there is a minuscule rise in the risk of cardiac events. By cardiac events, we mean the risk of heart attack or heart-related ailments. This risk is very, very rare. And with modern radiotherapy, it is again reduced significantly lower. So don't worry about the risk of cardiac events too much. Finally, long-term side effects, which is most common post-radiotherapy, is swelling of the arms. This is called lymphedema. The risk of this is very low. However, one needs to be vigilant, and exercises that have been shown to you by your doctors is a must to try and reduce the risk of lymphedema. Must reassure you again, look, these side effects are a full list of side effects that we have to tell you. However, these side effects are pretty rare. If you have any of these, there are various things that can be done to reduce the intensity of these side effects. So be rest assured that radiotherapy is a safe and absolutely essential treatment for your breast cancer. This reduces the chance of cancer coming back to the area of the breast significantly. So it is a treatment that you should not miss. However, it should be done under the guidance of a good team of doctors, nurses, and radiographers. Thank you.